Good afternoon. My name's Yvette, and today we have you scheduled for a routine breast and chest exam. And what this will normally entail is a very thorough exam to feel for any masses or any tissue in your breasts or in the lymph areas that surround your breasts. Also, whether or not there might be anything in the thyroid area here, and that would be problematic or could possibly be malignant. Well, breast exams are a very normal, encouraged activity. Once every month or so, it's usually a good idea to palpate the areas around the breast to know what to look for in the case that something were to be immobile. If you have any mass or any deformation, things like that, if caught early enough, sometimes it's just a matter of noticing it first. Okay. Well, with your permission, I want to make you feel as comfortable as possible. Is this something that you feel comfortable with me doing? I promise I'll be very gentle and respectful. Okay. Well, the first thing that I would like to do is to have you undress, remove any of your undergarments on the top, just on the chest, and to visually inspect your symmetry, if there's any abnormalities or any kind of deformations, okay? Okay. So if you just stand straight and place your hands on your hips. Okay. And do you mind pulling your elbows back? Okay. And do you mind placing your hands above your head? Okay. And push your shoulders back. Okay. Go ahead and put your hands down. Now, do you mind leaning forward a little bit? Okay. The symmetry is good. I don't see any abnormalities or any kind of deformations. You can go ahead and get comfortable again. Okay. Do you mind if I do a general assessment here with my hands and to feel breast tissue on each side? Okay. Thank you. Go ahead and just try to relax. And what I'm doing is I'm going to be taking my fingertips and in little circular motions, I'm going to move outward, and this is just going to be kind of a spiral, feeling for any tissue that is resistant and may not be moving, okay? It's a sort of palpation, but it's also in a circular motion, so it's almost like a massage. And it's also very common for breasts to be lumpy naturally. The breast tissue is a web, and a lot of it is fat tissue, so it's not abnormal to have some lumps in the breast. But what you're looking for, or what you're feeling for, is any tissue that does not want to move when you are trying to manipulate it. So if you imagine a web and you get something that's caught in that web, or a mass or a tissue, that part of the web has a lot of restriction. Do you mind putting your hands up for me? I'm going to go along the side of the tissue right here. Down the side of your chest a little bit. Okay. Go ahead and put your arm down. I'm going to start on this side here and do the same process. Just moving our way around the outer edges now. Do you mind raising up that arm? Thank you. And along the side. Very good. I'm going to take a listen to your respiration and your heart. Just want you to breathe normally for me at first. Okay. Just normally. On your side. Okay. All right, I'm going to place one hand on your throat here, and I'm going to be feeling for your pulse at the same time I'm listening, okay? Sounds good. Now I want you to take a couple of deep breaths in for me, okay? Okay, again. One more time for me. Your respiration and your heartbeat sound very nice. No irregularities that I can detect. I'm going to feel along your neck and your throat here. I want to see if there's any swelling in the lymphatic system, and then down to the center of your chest. Are you comfortable with that? Okay, thank you. Start here at your throat, by your ears. Okay. Work my way down your neck on your sides. And then by your clavicle. I'm going to palpate down the center of your chest. Okay. Is that okay? Thank you. I'm going to do the same a little further out. I'm going to palpate a little bit higher up here. I'm going to be pulling up on the tissue. I'm going to feel if there's any unsymmetrical areas as well as any tension, okay? Go ahead and try to relax your chest muscles as much as possible. any of these areas feel uncomfortable or painful? That's good. Okay. But let me know if there is anything, okay? Okay. If it's alright with you, I'd like you to take your index and your thumb and squeeze and nibble. I want to see if there's any discharge. Only as much as you're comfortable with. Okay. And the other side. Okay. Good. Alrighty. The next step, I'm going to have you lay down in a different position on your back, and then we're going to repeat a lot of these steps here. I want to feel the tissue when it is not being pulled downward, but rather to the sides and back. And then we'll continue the exam a little bit more thoroughly, okay? Alright, I'll allow you to get situated and be right back in. Thank you. Are you feeling a little comfortable there? Okay. If it's alright with you, I'm going to repeat some of those steps, and I would like you to start by lifting up one arm at a time. Okay, let's start with your right first. I'm going to just do the same process where I palpate the breast tissue. I might be pulling up on it a little bit and to side to make sure that all of the areas are moving, or if there is any obstructions that we can feel for it, okay? Alright. Do I have permission to do this? I promise to be as gentle as possible. Okay. Thank you. Okay. Go ahead and relax your arm. Just rest it underneath your head, okay? Thank you. Pull up a little bit here and from side to side. Any pain or discomfort? Okay, that's good. Okay. Ready to do the other side now? Up a little bit and side to side. I'm going to repeat this, but a little bit with firmer pressure. I'm not going to be going in circles so much as just depressions, okay? Let me know if there's any pain or discomfort. We're going to start from right. I know sometimes these can be tender areas. Not always the most relaxing kind, I'm sorry. It's always good to check, both men and women. Okay. Everything feels good. I'm going to feel your lymph again here. Work my way down your neck and your throat. Go ahead and just relax as as much as possible for me. Do you mind swallowing for me? Okay, swallow again. Okay. Very good. Alright, do you mind switching arms and putting your left one behind your head? Putting your right one down? Okay. We're going to do the palpations. Palpate. With your arm, go ahead and let it relax a little bit. I'm going to hold on to the back side of your arm here and let me support all of your weight. I just want to feel underneath the actual arm, right along the underside, okay? Go ahead and just let me support your arm. Feeling for any lumps or bumps or anything of that nature. A little tender right there. Okay. Go ahead and rest that to your side. I'm going to go ahead and do the same on this side here. Go ahead and let me just support the entire weight of your arm. Any pain or discomfort? Looks and feels good. I'm just going to grab something from behind you here. Do you mind opening up your mouth here and sticking out your tongue? Go ahead and lift the tongue to the top of your mouth. I'm going to take a brand new tongue depressor here. I'm going to move your tongue around from side to side, okay? Okay, just relax. Okay. Looks good. Alright, the last part of this, I'm going to put my gloves on because this can be kind of a tender area. Also with our sweat glands, sometimes people feel more comfortable this way. And start by palpating the area around your ribs and just under your ribs here, okay? I just want to feel some of the organs, like your stomach and your liver. Any discomfort here? As I move along under your ribs here, from your right to your left. Any discomfort? I'm going to press a little deeper as I go down your left side here, okay? Any discomfort? Yeah, this is the lower portion of your digestive tract. Start from your other side on your right. I'm going to work my way up, again depressing a little bit deeper. I'm going to go around to the very side here, not quite to your back, but I'm going to work my way up, palpating, feeling the glands that lead up to your armpits, and then inspecting the glands underneath your arms, okay? All ticklish. I'm sorry. Okay. Other side. I'm going to feel underneath your armpit areas here. I'm going to use somewhat firm pressure so that it will hopefully not tickle. Okay? Alright. Let me know if there's pain, discomfort, or if you need a pause. Okay. Any soreness? Okay. Wonderful. Alright. Thank you very much. I'll go ahead and allow you to get dressed. Everything feels normal. As I said, breasts can sometimes have natural lumps and bumps. It's when the tissue is not able to move in those isolated areas, especially for women who are close to menstruation. A lot of the times the breasts will get a little firmer, a little more tender, but it'll feel a little lumpier, and that's very normal. Usually when doing a breast exam, if you're a woman, it's recommended that you do it in the middle of your cycle. I'm sorry, let me rephrase that. In between your cycles. So say for instance, when you first get your period, wait a week and a half, 2 weeks before you do an exam, and that way you can get a baseline of what your breasts feel like and do that on a regular basis if anything changes. If there's any indentations, if you're looking at yourself in a mirror and you pull your head or your arms back behind your head and you notice any dimpling or deformations, if there's any discharge or if there's an inverted nipple, it might be good to speak to your general practitioner or your GYN about breast health, okay? You can always come in with any concerns that you may have or questions. I'll always be as respectful as possible and gentle when I have to be. Yeah, it's not too bad of an experience, but your general health is very important. And this also applies to men, although they are a minority with breast cancer. It is always recommended for any gender to do breast exams. Alrighty. Well, I'll allow you to get dressed, and if you have any kind of questions, don't hesitate to give me a call. Alright, take care now.